Okay, well, there is our cue to go ahead and get started. Thank you, everybody, for joining the Institute for Disability Research, Policy, and Practice, Autism Echo. We're thrilled to have you here. If you will take a minute and put your name and contact information into chat, it's just that start of our professional networking and getting to know everybody on the call. As you notice, we are recording today's session, so by participating, you're consenting to be recorded. We store these on our Canvas page, so if you would like access to that, please send us an email at autismecho@usu.edu and we will get you set up. So I want to give a big shout out to Colin and the children with special health care needs at Department of Health and Human Services, who helps provide some funding for this project. And we are also really excited to announce that we will be starting a new network in August. So we will have that registration up in the next few weeks. So hopefully you can join us again next year for some great topics around autism. If you've never joined an ECHO session, we are just thrilled to have you here. We have some core components of an ECHO, and we always will have a subject matter expert. Today, we are really lucky and thrilled to have Dr. Casey Clay from Utah State University present to us. And then we will be we're not doing case presentation today. We're kind of doing some community questions. As a hub team, we all, as we were thinking about this, started thinking about some questions and wanted to know what everybody on the call thinks about these things and what is your go-to things around early intervention and supporting families. So please stay on for those. It's a great way to learn from everybody. All your colleagues, everybody has some great information that builds that professional networking. We love that interaction. So if you have questions or comments or anything, please put those in chat and we'll make sure those get answered. We are saving all questions today till the end of the call. Colin will be monitoring that for us. And then also just a reminder that case narratives are a great way to learn from everybody on the call about a case that we are either struggling with or that we just want to make sure we're on the right track. I don't know if you're like me as a provider. Sometimes I want to know what I'm doing is correct, and getting that affirmation from everybody to say, yeah, that's exactly what I would be doing too, is helpful. So if you're interested and would like to share a case, that's a great way to get really great information and different perspectives. So reach out to us and we will get you on the schedule. And then just a reminder about some session etiquette. We encourage you to keep your cameras on. It helps us as presenters seeing people's faces versus a black screen, as well as it helps us just get to know each other on the call. Please remember to keep your questions brief and on topic and introduce yourself. We do talk about sensitive topics, so remember to protect individual privacy. If you have any questions about that, feel free to reach out to myself or any of our amazing hub members that has an asterisk in front of their name that makes them easier to find in chat. So you can always reach out if you're unsure of that. Renaming your profile and raising your hand, making reactions. We've all been on Zoom long enough, probably now longer than any of us thought we were ever going to be. But if you have any questions, here is a slide on how to do that. Throughout today's session, we will be dropping in a survey link. Thank you to everybody who always completes those surveys. We really do take the information that you guys share on the surveys to dictate what kind of sessions or what topics we share. And so throughout today's session, Leo will be dropping that survey link in, and then we email out monthly certificates that you can then use towards professional development. Canvas is where we store everything. So if you would like access to your Canvas, our Canvas page, please email us at autismecho@usu.edu and we will get you set up for our Canvas page. It's also where we store all of the small breakout groups discussion points. So sometimes we don't have time to come back and learn what every breakout group is talking about. But you are always free to go and download all of those resources and recommendations. You guys all come up with amazing ones, and so it's a great way to just kind of build your toolbox. Just another plug for case studies. Our social media, if you've not followed us and you want to take a minute to do so, that will be great. And then I'm going to stop sharing and turn the time over to Dr. Casey Clay.
Okay, thanks, Janelle. Let me share slides. Okay, how's that? Can everyone see my slides?
Yep,
We're good.
perfect.
Okay, excellent. Well, thank you so much for having me today. And as Janelle mentioned, I'm Dr. Casey Clay. I'm a board certified behavior analyst at the doctoral level, and I'm a professor at Utah State University. I've also have roles as a clinical director for Intermountain Health and ABA, and I've been a clinical director at Children's Hospital of Orange County, as well as Thompson Autism Center in Missouri, and was previously a professor at the University of Missouri. And so today, what I want to share with you is how I work with kids with autism in terms of working with challenging behavior. I've now been in the field for over 20 years and have worked in numerous states and locations across the country. I've also consulted internationally on challenging behavior cases of kids with autism. And so, what I'm hoping today is to give you kind of just the basic introduction, not go too deep, but to kind of give you an idea of a foundation of maybe how we should be viewing behavior when we try to approach it, to change it, and to really set up those that we serve with autism for success. And I think to begin, what I want to do is make sure I share with you my philosophy and kind of how I operate and where I'm operating from. And you might have a lot in common with this, or you might think, okay, this is radically different from my understanding of behavior and human behavior. Um, so the most important thing is that behavior is maintained by its consequences. So that is the things in the environment shape and determine our behavior. And an example of this you may be familiar with is called the hot cold game. So this is where you have a bunch of people in a room and you have one person leave the room, and then you either hide an item or you kind of decide on how what you want to do when that person comes back into the room. And then everyone in the room just says hot, hotter, colder, colder. And then when that person comes back in the room, you can shape their behavior through consequences, right? So the person will come back into the room and everyone in the room might say, okay, find the item. Okay, you're getting hotter, hotter, hotter. And then you see their behavior change as we provide consequences. And so this is kind of that underlying philosophy of, behavior is really shaped by its consequences. Another key point is that in behavior analysis and in behavioral science, everything we do is behavior. So not just bad behavior. I know sometimes maybe in other environments when people say, oh, they're having a behavior or they had some behavior this afternoon, right? It usually refers to like bad behavior. But really, really want to try to operate from this perspective of everything we do is behavior. And so everything is, a function of its consequences and can be changed and behavior can be changed and shaped. So that helps us to really influence behavior, right? And increase the likelihood or decrease the likelihood that behavior occurs or doesn't occur. And we do that by changing the environment or the consequences we might provide and arranging the environment to change that behavior. And while some people say, this, it seems like a pretty rigid interpretation, and, not all behaviors kind of like this. I think this is a really hopeful interpretation in terms of the behavior is malleable and can change. Whereas if we put a label on a behavior and then that label is just stuck with someone, they can't really change out of that. So so one thing to focus on is the idea that behavior can be changed by consequences or how we change and improve the environment. Some other assumptions about challenging or problem behavior is that most behavior, whether it's problematic or not, is learned. We learn it throughout the course of our lifetime, right? And so the environment then selects those behaviors that are effective in producing a desired outcome, right? So if we're learning behavior and how to engage across our lifespan, the environment was what we call as selecting those behaviors by providing good, and then we'll see more of that behavior, or maybe no consequence and that behavior will go away. Or maybe even a bad consequence. For example, if you've ever walked into a sliding glass door and that hurts, you hit your head, you won't do that again, or you're going to be more careful walking through that door again. So the environment really shapes our behavior and selects for different behaviors. Another thing that we also work from in terms of assumptions of challenging behavior is that problematic behaviors, even desirable behaviors, have common consequences, or what we say is common functions. They function in a certain way, right? So behaviors might function to get us attention, right? We might say like, excuse me, right? If I want your attention, I might raise my hand, or, I might throw something at you from across the room, right? There are different ways to get attention. Another big kind of category or a function that's a common consequence is access to preferred items, right? So asking for a drink of water, right? Asking if you can play on the tablet, asking or getting up and going and picking up toys, right? So we engage in a lot of different behavior to get access to preferred items or activities. Another category is to escape aversive events. This is a really common category, not only for individuals with disabilities, but really for all individuals. We work to, get things done. When we have a task list or we plan our day out, we might check those things off. And as we check those things off, right, we feel better and better because we're getting things done. So one way that you might engage in behavior to escape aversive events is appropriately getting things done, or you might also ask, say like, I need a break. Can I just have a break? I need to escape this. Right now, this task is too much. Can I just take a little short break, right? Or, as sometimes we see as problem behaviors develop, you might do something even more. You might tear up your homework. You might flip a desk. And when you do that, the aversive event stops, right? So that consequence then it might reinforce that whatever behavior is happening to escape that aversive events. And we see that a lot with challenging behavior. And the last kind of overall category is kind of a catch-all category, and this is like automatic stimulation. So we engage in behavior because something within us feels good, right? And we can't really see within our skin. So we say it's likely there's some kind of automatic stimulation that's the consequence for why that behavior is occurring, right? And you might see this, for example, individuals with autism might self-stimulate, right? They might like wave their hand, or they might fidget like this, and that's why that behavior is occurring. We also can see this, in neurotypical developing individuals. For example, if you like to dance to music, right? Why are you dancing this? This is automatic stimulation, right? You might like to dance, or if you like to sing and sing to yourself, those are forms of kind of automatic stimulation or why behavior is occurring. Okay, so now that we're kind of some background and foundation of the assumptions and the philosophy that behavior analysts work from, I want to just talk about the profession of behavior analysis because it's a fairly new profession. A lot of the science and the applied science and the studies were done in the 1900s, and just recently around the 2000s, we saw more certification and licensure happening for behavior analysts. So the term that we use is simply a behavior analyst, somebody who works with behavior and can modify and change behavior systematically. And we really rely on objective and reliable measurement, right? And so to do this, we really dive down and focus on behaviors and define them, right? And have a really clear operational definition of every single behavior that we see, right? So if we say, oh, that kid had a tantrum. Well, what does that mean? Tantrums look different to different people. So we want an operational definition of that kid flopped down to the floor. They were crying for more than 3 seconds and pounding their fist on the ground, right? So we really get specific with defining the behavior so that everybody's on the same page when we record and measure that behavior. So we make sure that we're recording that accurately and then presenting that. And we do that through direct observation. So we really want to see the behavior happen. Although, and I'll talk about kind of anecdotal reports, or if people say, here's what I'm seeing the student do, or here's what I saw my child do this afternoon. Those anecdotal reports are helpful, but we really want to rely on direct observation with an operational definition when we're defining and measuring and changing behavior. Another thing that a behavior analyst focus on is this environmental determinants of behavior. And as I mentioned, behavior is shaped by consequences, right? Why do we see the behavior that we do daily? Why do we engage in different behaviors? The environment kind of determines that. The consequences shape that. And so we focus a lot on reinforcement. So if we engage in a behavior and something good happens, and then we see an increase in that behavior, we say that behavior has met reinforcement. Right? And so when we focus on changing behavior, we really want to reinforce positive, healthy, or alternative behaviors and see more of those behaviors, because when we do that, we see, challenging or problem behaviors decrease, and we see more alternative behaviors increase. And you might say, okay, got it. I understand what behavior analysts do. I do that as a teacher. I do that as a speech and language professional. I do these things too. That's great, right? I think, what behavior analysts do, maybe above and beyond that, is this rigorous treatment evaluation. So we're taking data on that, and then we'll put a treatment into place, and we'll evaluate if that treatment's effective, right? So we change the environment and then see if behavior changes, then we might actually remove that treatment. Does behavior change back, right? And so when we can rigorously evaluate this treatment, we know specifically our treatment worked. And as I mentioned, this is a fairly new credential. It came about during around the 2000s, and we are referred to now as board certified behavior analysts and have a certification board. So as I mentioned, behavior analysts view everything as behavior. And so if we view everything as behavior, we can work in lots of different areas. And so here you can see this pie chart of different areas where behavior analysts might work, right? So it's not just, although ABA and behavior analysis are commonly associated with autism, there are behavior analysts in a variety of different fields. You will see from this pie chart, about 75% of behavior analysts do work in autism spectrum disorder, right? So that is a majority of where behavior analysts are working. But I just wanted to show this to show you kind of, behaviors everywhere. And as such, we have behavior analysts in an array of different fields and areas. Okay, so focusing a little bit more on challenging behavior. Specifically in individuals with autism. So here's some statistics. So it's been reported about 59% of individuals with autism engage in some form of self-injury, aggression, or destructiveness at some point in their lifetime. The Autism Research Institute gives us these numbers. Next, elopement. You may be familiar with this. If all of a sudden, a child just kind of bolts out of the classroom or bolts away from you and runs away, we define that as elopement. And this can be a very serious behavior to address, as you can imagine running into dangerous areas like a street, or running away and not being able for an adult to find you can become a safety hazard. So for elopement, a recent parent survey found 49% of children with ASD engage in elopement after the age of 4. And then we see also those safety hazards of the risk of drowning or the risk of running into a street and being struck by a motor vehicle. Next, just in general, severe behavioral challenges. So, in individuals with an intellectual disability, up to 50% experience behavioral challenge, and 5 to 10% of these have severe challenges. So, these are things like daily aggression, aggression that is being directed at family members or peers, that impacts that environment greatly. Severe self-injury that leaves tissue damage, or requires emergency room visits. We see that in about 5 to 10% of individuals with autism. And then last, just general challenging behaviors. So studies report about 28% of children with ASD have SIB and other disruptive or self-harming behaviors. And so those are also fairly common. Okay, so now I'm going to dive in a little bit more to the terminology and how we work with challenging behavior and how we understand it, right? And so we work from the basic understanding there's a three-term contingency. So there are antecedents in the environment, then we see the behavior, and then a consequence follows the behavior. We see this across pretty much any behavior that occurs from any individual throughout the course of their life. Right. So behavior then is more likely to occur in a given circumstance because it's previously produced a desirable result in that circumstance. Right. And you may say, okay, I get that. That's very intuitive. But a lot of times we forget that. Right. And we don't look to the environment or the consequences that are happening that are influencing that behavior. So, for example, when a child wants a channel on the TV changed, they might politely ask their housemate to change the channel because in the past this has resulted in that sibling changing the channel, right? So in this case, the antecedent is wanting the TV channel to be changed, right, or the wrong channel's on. The behavior we see is asking politely to change the channel, and the consequence is the channel gets changed. And you can see if we use the same antecedent behavior consequence contingency and there's challenging behavior, there's also antecedents and consequences surrounding challenging behavior. So we can start to manipulate the environment to change that. So kind of going back to now, so these common consequences, what is the function of the behavior? How is this behavior functioning in the environment? Or how does this function for the individual, right? It might function to get them attention, right? So some examples of attention are things like a praise, good job, you did that, that's so smart. A reprimand, hey, don't do that. Or if you do that again, you'll be in trouble. Concern, hey, don't stop hitting yourself. You know that you're going to hurt yourself. Arguments, right? Just getting back and forth, engaged in an argument with a client might say, well, you said I could stay up till 9, or you said this, or a student saying that back to you. And then other just more nuanced social actions, such as a simple facial expression. If I'm smiling while you're talking to me, you might continue to talk to me. If I look away or I pull my phone up, right, those things would lead to less attention from an individual. Another common consequence is this access to preferred items or activities that we talked about. For some frequent examples of these are things like edibles, so desserts, snacks, favorite foods, leisure items. You have your favorite toy and that's getting taken away from you. You really wanted to, watch TV or watch a movie or play on your iPad and now you don't have access to that. Or simply access to just having things your way. Right. So a lot of times we might provide what we think is a reinforcer or a good consequence for individuals, and they actually don't like it like that. And they'd like it to be presented their way, right? Or they want to select what they want to do next, right? And so that it also falls in this category of access to preferred items or activities. Also, as I talked about previously, a common consequence is escape from aversive events, right? So simple demands like, hey, stand up and shut the door, or hey, could you fill out this application? Common things we see with kids, chores, cleaning room, clean up after yourself, you made a mess, can you do the dishes, do laundry? Simple day program activities. A lot of adults with autism might have day program activities that they find aversive or challenging. Any types of loud noises. These can be, we might see more sensory sensitivities in this population. And so things like loud noises or something that's a constant background noise that we might not pay attention to might be really aversive for someone else. And then last, things that are previously associated with an aversive event. So things like a specific parent, or a specific staff. Just simply seeing that person, or a specific teacher might simply seeing that person might set a student off, right? And that's because they were associated with other aversive events in the past for that individual. And so they're going to engage in behavior to try and escape those aversive events. And last, as I mentioned, automatic stimulation, right? So things like pain and attenuation. So if you have a sore muscle and you rub it, or you have a headache and you rub your head, right? That gives you pain attenuation. That's a brief break in the pain. And so you might engage in that, and that's automatic stimulation. So you'll engage in behavior that removes that, or removes that pain. Other examples are scratching to relieve an itch, or some verbal behavior or stimulation, like I said, right? So you get automatic stimulation because there's the way you say a word, or if you sing, or if there's a particular word you say over and over again, that might be generating some automatic stimulation. Okay, so now that we understand kind of why behavior is happening and some common consequences, now to really change behavior, we need to start with an assessment, just as most people do, right? So we call this a functional assessment of problem behavior, or why is that behavior happening? What's the function of that problem behavior? So to do that, we need to identify the antecedents and the consequences, right? Um, and so when we're specifically functionally assessing the problem behavior, right, we look at those antecedents and we might specifically remove or withdraw attention, or see how that person acts in an environment where they're not getting a lot of attention, right? We might specifically deny access to a preferred item, right? Or see how that person acts when we're observing them and they don't get access to a preferred item, right? And so we're specifically assessing the problem behavior, or the challenging behavior, or really any behavior, to see why it's occurring, given the specific environmental circumstances. For consequences, right, we might deliver preferred attention and see if when we deliver preferred attention, we see more of that behavior. We might give access to a preferred item following a behavior. And if we see more of that behavior, we've assessed that and we can conclude, okay, we gave access to this and they continue to do it, or they reinforce their behavior. So we could say that, access to these items or these consequences, right, increase the behavior or made the behavior go away. Right? So this is how we systematically assess challenging behavior to see why it's happening. And in the world of behavior analysis, we've developed methods and tested these methods over and over again through thousands of studies in terms of how to do assessment, how to really get specific, and different types of assessment methods, right? So there are three main types of assessment record methods, and I have this umbrella here because you can kind of think of functional behavior assessment as an umbrella, and then several different methods below it, of ways that we can assess. One way we can do this is through anecdotal methods, right? And we call this indirect. So we can just ask, why is this challenging problem behavior happening? We might ask a parent, we might ask a teacher, why is this happening, right? And that gives us some information. Next, we might observe, and we do this through descriptive analysis. So when we directly observe a behavior, we write down, okay, so this happened for the antecedent, then the behavior occurred, it was followed by this consequence. And this is a descriptive analysis. So we're looking at the environment and we're writing down the antecedents, behavior, and consequences. When this happens, though, frequently we see things that are correlated, but might not be causal. Right. And so things like if you saw someone sneeze and then someone said, bless you, right? And then they sneezed again, you'd say, okay, well, that consequence is maintaining sneezing. And we all know that's not likely the case, but because in a descriptive or naturalistic analysis, we're observing that, we might make those correlational conclusions. However, that's not causational. Right? And so that's why we've developed functional or experimental analyses. In this situation, we specifically introduce antecedents and consequences and remove them and then measure the behavior to see how that it's responding. A common example that we have of this that people might be familiar with are if you've ever had an allergy panel, you've gone in to see what you're allergic to, and they specifically like prick your skin with different types of allergens. And if your skin flares up, you have a reaction, then they know that that allergen is what you're allergic to, right? So that's an experimental way of determining why that reaction is happening. We have also experimental ways of determining why the behavior is happening. So we might deliver different consequences or remove different consequences and see what that does to the behavior. Um, so now I'm going to drill into kind of these methods a little bit deeper. So for direct anecdotal methods, which I think is pretty common, a lot of us as teachers or the work with kids and early intervention use pretty frequently anecdotal methods, right? So we try to gather information about a behavior, why it's happening, just by asking other people. We might not have seen it, but we want to try and change this and help this individual, so we're going to ask why it's happening. So some examples are things like just basic interviews, checklists. We fill out rating scales. And a lot of this is really similar to like if you go into your doctor or your pediatrician, they're going to ask you questions and you give them information and they provide a suggestion based on that, right? And a lot of the times they're right about that, right? So a major strength of this, right, is it's simple, it's easy to gather access to this information, and we don't really have to directly observe it. It's more feasible and likely that we can just gather this information by asking. However, a major weakness of this is the subjectivity, right? So if you're asking a parent, kind of like, does your kid ever do this? And they, oh, my child will never do that, right? They might be responding based on, if they think you're going to judge them or if they don't quite remember what happened. I know, for example, in my case, I can't often I had for breakfast this morning. So I'm not going to remember if someone asked me, what was my kid doing or what did this look like, right? And so subjectivity and other types of events kind of weigh in with indirect anecdotal methods. So it might not be as accurate as we think. So if we want to get more accurate, we might say, okay, I want to observe this. I want to describe what I'm seeing in a naturalistic setting and do a descriptive analysis. So we directly observe behavior under sort of these naturalistic conditions. So some examples of this are, narrative recording, watch what happened and write down specifically what happened. We might also have quantitative data and observation schedules, so we can take data throughout the day. A teacher might say, okay, I'm going to make a tally every time I see this behavior from this kiddo. However, again, the major weakness of this might only identify correlational relationships, right? So just because we see something happen and we think, okay, we saw this antecedent happen, followed by this behavior, followed by this consequence, that might simply be correlational. That might not be causational in the sense of we really know why the behavior is happening. It just gives us more information. It's more direct, so it's a little more accurate. However, there's still that weakness of we might just have a correlational relationship. So last, the most specific and accurate way to kind of determine why a behavior is happening is to do a functional analysis. And so here we identify these functional relations through manipulation of these controlling variables, controlling the antecedents and the consequences around the behavior, and see what that does to the behavior in terms of how that changes. So one example, right? So we get very scientific about this. So we have a test condition and a control condition. So in our test condition, right, we might see the behavior and then we provide a consequence. So if the child throws a toy, we might say, no throwing, or why'd you throw that, right? Because we're giving them attention. And then if they continue to throw it, we know they're probably doing that for attention, right? And then we record behavior in that condition and we compare that to a control condition, right? In which they throw the toy and there's no response, right? Or we could flood them with attention, give them like no throwing, or remember, you don't throw your toys ahead of time, and then see in that control condition if the behavior occurs. And we compare those conditions. So the major strength of this is that we identify now a functional relationship between the behavior and the environmental consequence. However, weakness is this gets very complex. I also wouldn't recommend doing one of these assessments unless you've had training in this. If you've had the training, you're usually looking at security concerns. You're usually looking at, the risk reward of providing a certain consequence or withholding a certain consequence. So you really have to be more expert and trained in doing a functional analysis because these can get complex to determine why a behavior is happening. Okay, how are we doing on time? About 15 more minutes? Is that right?
Yep, that will be great.
Okay, great. So, what do we do about this, right? So we've assessed behavior, we kind of understand why it's happening, right? um, what we primarily do and what in 90% of the cases that's effective is called functional communication training. Again, there are thousands of studies on this demonstrating that this is a really effective way to decrease challenging behavior. There are lots of different ways to do it, but the basic idea here is we teach an appropriate communication to replace an inappropriate behavior, right? If behavior is occurring, it's occurring for some reason, right? It's meeting some consequence, right? So if we don't want to see that, well, we train a different way or teach a different way to appropriately get that consequence. And so to do this, first we do that functional analysis or we do a functional behavior assessment to understand why the behavior is happening, right? And so say a challenging behavior is happening to get attention. Well, then we need to teach another way for them to communicate appropriately, raise their hand, say, excuse me. Maybe if they can't, they don't have verbal or vocal communication, they touch a card to get attention, and we deliver that attention. So, as I mentioned, problem behaviors are all often a form of communication from an individual. This is why this is happening. They're trying to communicate that they need something and they can't communicate it, or it's too challenging to communicate it, or they need more practice with appropriate communication. So, that's how we want to teach appropriate responses. Um, Again, this might seem like, okay, this is very intuitive. Like this isn't rocket science. How come this we still see challenging behaviors and that this happens? Well, with functional communication training, it's a process, right? So first we identify that function of the problem behavior through that assessment and functional analysis. But then we got to kind of understand the communication modality of the learner. Can they speak? Do they engage, have sign language? Do they use a picture exchange system where they hand you a picture to get access to something they need if they can't speak? Is it something as simple as just adapted sign language? So, just raising their hand to get something. Because what we want to do is identify the lowest effort response that gives them that functionally equivalent consequence, right? So when we do that, and then we have a really easy, form of communication for them to get what they need instead of engaging in the challenging behavior, and we practice that and then deliver that consequence, it establishes a new learning history. And so we specifically set up these training and practice trials where they're practicing to communicate for what they need, and then we deliver what it is they need or that consequence. And an important part of this also is differential reinforcement or DR. So we want to provide reinforcement for that appropriate communication, and then we're going to not provide reinforcement for that challenging behavior and not deliver that consequence for the challenging behavior. So once we have kind of this really basic functional communication response or FCR built up, or it's been taught, we have to build it up, right? Because just because we've taught that one-on-one with a person, it doesn't mean that that individual is going to use that in their environment or in other situations. So we have to teach ways for them to communicate, to get reinforcement in other circumstances where someone might not understand sign language, or they might not know that, if someone hands you a picture, that's what they want, right? So we shape more complex and polite requests. So we might say, okay, may I please have some goldfish versus snack, right? Because you don't know, if someone just shouts snack randomly, you don't know what it is they want. So we want to get more specific and build up that response. That being said, too, you might be thinking, okay, well, we can't just always provide the consequences whenever they request something. Sometimes things aren't available. Sometimes you run out of snacks, right? So because of this, we have to introduce delays so that the learner can tolerate either waiting or being told no, right? So we specifically practice this in functional communication training. Once we build up that response, is practice, well, you know what? Wait 1 minute and then you can have it. Or, not today, unfortunately, maybe we can get it tomorrow. So what this looks like in terms of expanding FCT is we start with that simple functional communication response, right? And then we build it on more complex functional communication response so that that response can get access to reinforcement in a variety of environments. And then we introduce that tolerance training. So practicing being told no, practicing being told they have to wait. Okay, so now I want to talk about a quick case example of functional communication training. So in this situation, I was working with a Spanish-speaking 4-year-old with ASD, and he got really aggressive, right, when he couldn't have access to his toys, specifically a tablet, a favorite show on his tablet. And so what we did was we conducted sessions of functional analysis, and we did this in Spanish. And again, when you're working with a variety of a population of individuals, you're trying to functionally assess and recreate the environment that most closely resembles when you see that behavior happen, right? So we conducted all of the sessions in Spanish. And after we conducted our functional analysis, we determined the aggression was being maintained or the consequence was happening was he'd get access to a tablet, right? So if his mom said, you know what, no tablet, tablet's done for the day, he'd hit her, right? And she'd say, oh, just well, okay, you can play for it for five more minutes, right? So we determined that that's kind of what was happening, right? Or he'd get access to something. Same thing was happening in school and his preschool, where if a toy was taken away, he'd hit the individual and he'd get to play with that for a little bit, right? So he got access to what he wanted. So we used functional communication training to work in teaching him appropriate ways to request for the device, the tablet specifically, right? And then we progressively increased the duration of time when we told him no. Right. So to start, right, a session for simple FCR, we removed the tablet, right, and we told him, okay, you can say quiero tableta, and he said quiero tableta, then we'd give it back to him, right? We're specifically practicing this antecedent behavior consequence chain to build up that behavior, right? So we do that over and over and over again until he's reliably doing that. Because at first when we were doing that, we took the tablet away, he'd hit us, right? Or he'd scream and come on and try and scratch us, right? And so we want to stop that behavior and we want to increase this communication behavior. So after several sessions, he picked up the request, right? And so now we have a functional communication response. So next, we want to build up this FCR to make it more complex, right? So now what we taught him, instead of just saying quiero tableta, we taught him to specifically get someone's attention, right? So come up and tap it on the shoulder. So we redirect our attention away from the child. He'd have to come up and gain our attention, tap us on the shoulder, then say quiero tableta, because this is what we wanted him to do at home and in preschool, right? Get someone's attention, then ask for it. So we have to build up the functional communication response so it's getting access to reinforcement in a variety of circumstances. So we did this several times. We practiced this over and over again. And again, he picked up this skill first to gain attention, then ask for the tablet. Another common way to do this is teaching kids to raise their hand to get attention and then wait for that attention. Then the last phase of this is tolerance, right? So being told no, or you know what, you can't have your tablet right now, you need to wait, right? So what we did was we set a schedule where 40% of the time the request was honored. If you said quiero tableta, he got it, right? And then 60% of the time we said, not right now, but you can, play with something else while you wait. And so, we practiced this schedule of reinforcement with him. And the idea here is the amount of time for waiting or being told no starts small and achievable, right? So that they're successful. Then you build up that time for more reasonable amounts of time for them to wait, or more instances of them being told no and kind of tolerating, saying, that's okay. I don't need to play with that right now. So the end goal here is, waiting long enough that's reasonable. Or if it's something where it's like, the tablet's broken and he has to wait until tomorrow for it to be charged or fixed, then we want that to be the end goal and build up to those amounts of time. So some important considerations with functional communication training is you have to have the right preferred items or the preferred attention, right? If you think that, challenging problem behavior is being maintained by access to attention, you've got to deliver that specific type of attention. If that's, no, don't do that or stop doing that, you're going to hurt yourself. You want to deliver that form of attention, right? Or if it's praise, like, good job, keep doing that. Make sure you're delivering that form of attention. Or if it's a specific item, you have that specific item. If it's being maintained by escape from aversive items, you want that a specific task, practice in that specific environment with that aversive contingency present. Obviously, like I said, there's considerations around this with safety. So you want to be trained in this before you just go and start introducing, potentially something that so aversive the client, can't handle it, right? Or that the kid even escalates their behavior. So there are ways to, be trained and to gradually introduce this. Ensure that you have their attention, like they're not distractive when you're doing functional communication training. If they're worried about something else or they want something else, then sitting down and practicing something with them where you're taking away something they don't want isn't going to be that motivating and won't spur a lot of communication and a lot of good practice. Also, you want to be correct. You want to make sure you're correctly using and fading prompts, right? So, if you can't have this, or if you want the tablet, you can say tablet, please, right? But then eventually you can say, if you want tablet, please, you can maybe fade the prompt to having a written statement that says, ask for tablet, say tablet, please. Then you can fade out the prompts as you're teaching them to engage in the right form of communication. And you can use, partial vocal, full vocal, or partial prompting, either physical guidance to partial physical guidance to try and get them to use that appropriate alternative behavior or communication. Okay, that's functional behavior assessment and functional communication training in a nutshell. Here's my contact information. I'm happy to answer any questions. As I mentioned, I'm a professor here at Utah State, and we do have a clinic on campus here where we work with challenging behavior. So if you're needing those services, please let me know and reach out. If you need help with consultation, please also feel free to reach out. This QR code actually goes to my Instagram, so you can follow what me and my lab are doing if you are interested in learning more about that. And then last, I want to leave you with this. This is a link to a YouTube video by Dr. Pat Fryman. And he talks about who is a scientist in the field of behavior analysis, and he's also been at Father Flanagan's school for teens in Omaha, Nebraska, for decades. Worked with several challenging cases, and he talks about how there's really no such thing as a bad boy or a bad girl. It's really the environments that shape the behavior and that are controlling that behavior, and we should kind of get away from these labels, whatever they may be, and look more to the environment and how we can set up people for success by providing the right consequences and teaching them more appropriate responses and practicing that. And that is everything. I'm not sure if we have questions, but it looks like we do have some time for questions.
We do have some time. There was one thing that says that the QR code had been deactivated.
Oh no, which one?
That's what I'm not sure. Leo has put in the link for the bad boys. So Karma or Randy, do you know which QR code had been deactivated? Oh, it's the bad boy one. So maybe Leo linked it.
Oh, thanks, Leo.
I will open it up to questions. Colin, I don't know if any came in throughout the session. Or if anybody just wants to come off mute and ask.
I don't see any in the messages, so if anybody does have something they'd like to present now.
So, Dr. Clay, I have a question about the clinic up here at
Sure.
Utah State. Do you take insurance, or is it a sliding scale? And do you also travel throughout the state of Utah?
Yeah, great questions. We do take insurance. We don't have a sliding scale yet. We're working on that. And we don't travel throughout the whole state. However, we will go down to like Weber County. Frequently, we can do telehealth arrangements as well and consult from that angle. So we try to cover as much as we can and provide services to the biggest range of people.
Great, thank you. So again, Leo's linked in Dr. Casey Clay's Instagram one, since that QR code does also seem not to be working. I just want to thank you. The way you presented that seems like it's so easy to treat behavior, which
Yeah.
we all know that is not the case.
Right, right.
So
Yeah, and
there,
I
go
will
ahead.
say, it's very important to, get that training, contact a BCBA, and reach out, because, we have a lot of experience dealing with this, and we'll have more experience in, tailoring the assessment and the intervention to your specific conditions, as well as making sure that that behavior change maintains over time. A lot of time we forget about that, we want the behavior to continue to happen. We think, oh, that's fixed, and we kind of walk away, but we really have to change the contingencies in the environment to make sure that behavior continues to happen.
Um, so another question that I have is, how do you guys, when you're working with families, approach it, especially if families want a quick fix? And as you've just shared, it's not just a quick fix on behavior.
Yeah, definitely. So, when working with families, a lot of that is also kind of an education approach, teaching them these same things about behavior and why behavior is happening, and understanding kind of, there's a little bit of work that goes into this, and there's some consistency kind of, on the part of the parents, or it might require an environmental change. And so, there is that kind of education piece. That being said, there are situations with, severe challenging behavior where we do need to stop it immediately. And so in that case, we might consider different types of protective equipment, um, uh, uh, to go in and to stop the challenging behavior. There's also, options for that family to reach out to their doctor, get medications, to take as needed to kind of calm down in that moment. And those are for, more severe cases that really require that quick fix. I will say there is a new inpatient unit, through Intermountain Health in Taylorsville. So if you are dealing with very severe cases, that inpatient admission is an option as well.
Great, thank you. Two questions in the chat. So Itara says, for virtual, do you accept out-of-state clients?
Oh, that is a good one. I through the clinic, I'm not sure if we're set up to do out of state clients. Um, there may be something where I could consult personally, but I think that simply contact me and we can talk about your situation and we'll figure out a solution. If not, there might be someone in your area. There's definitely a network of challenging behavior specialists in other states that I'm connected to, and so we can find a solution.
Okay. Then from Lucia, and I apologize if I've said names wrong. So it says, could you give me an example of the vocals partial full?
Oh, yeah. So I think that she's referring to when you're teaching a functional communication response. You might, give a prompt that's a vocal response from you as the teacher or the parent. So you might say, say tablet, please, right? And that's a full prompt. Say tablet, please. So you take the tablet away. You're practicing asking for say tablet, please. They say tablet, please. You deliver it, right? Then once that established, you fade that. So you might do a partial vocal. So you might say tablet, and then they say tablet please, right? Then you might say, right? Then you might just go S. And so you fade out your vocals, as the prompt continues and they're continuing to have success with their functional communication response. Hope that answered that question.
And then Leslie has one. It says, how do you balance educating and training parents to respond appropriately with their children as they're learning these skills with not blaming parents?
Oh, this is an excellent question, Leslie. I love this. And I typically, when I'm working with parents, the first thing I tell them, is it's not your fault, right? It's not your fault. There are so many different things that their kid is exposed to throughout the day, through whether that's school, whether it's things that, the parent's not aware of. And so you can't control all of those things, right? What you need to focus on is what you can control. And that's kind of the parent's response and what they do in the moment, right? So they don't need to take the blame. But I think, it's good for them to feel empowered that they do have a skill set of things that they can learn to change their kids' behavior. Because yeah, I definitely never want a parent to feel like it's their fault or to feel the blame. That's obviously not going to help them long term or really help them focus on their goal of, how do I improve or how can we make a better situation by changing circumstances or practicing appropriate behavior.
Great response. Thank you. Okay, 1 more minute for questions. We all love the silent Zoom
Yeah.
pause.
And because I'm a behavior analyst, sometimes like vocal questions are hard, so I'll give you other opportunities to communicate. Please feel free to email me. I'd give you my personal phone number and you could text me, but then I get too many questions sometimes. So lots of different ways to get in contact with me. And hopefully I can answer questions or provide help or provide more resources where possible.
Wonderful. Thank you,
Yep.
Dr. Casey Clay. It's been wonderful.
Thank you for having me.
Okay, so for the next piece, we are moving into our breakout groups. Each hub member has their questions, and this is going to be a great time for us to all talk about the behaviors that we experience, where we go to for referrals, and just learning from each other. So, Leo, if you want to put us in breakout rooms.
Sorry, Janelle, you're
I
you're on
know, I
mute.
just said to myself, that means I'm on mute. So let me get that. So we're all back. We have just a few seconds to go over. So Stacy, what's one big takeaway from your group?
One big takeaway that I really liked is for parents to prioritize. That way they can keep it simple. Pick 3 or 5 things that they really want to focus on and not get caught up in all the things and get in the weeds on it.
Okay, that's a great one. I like that. Colin or Colleen?
I actually liked that one too, but that was kind of very similar to the that solution focus kind of asking, if they ask what do I do next, asking them what, when is it the hardest for you, or what part of life do you feel like you want to focus on, and then helping them find something for that
That's
to start
great.
with.
Yeah. And that's kind of what we talked about as well. Our group had so many great discussions and information for everything. So I'd encourage you guys all to go and look at these recommendations after they're posted on Canvas.
Good
The
for
other
you.
thing that I'm going to post to everybody that our group was talking about at the very end, and that is Spanish translated resources. So I'm going to pose it to everybody. If you guys know of resources that are in Spanish, share those with myself or Leo or just the Autism Echo, and let us kind of learn from each other and have those resources. So, and then I'm going to just end it with a reminder that we are taking July off. So enjoy July as a free month. and we will start with a new network in August. The registration link will be coming out soon. So, but it will still, our Autism Echo will still be on the fourth Wednesday of every month. Ooh, good. Yay, Colleen. Share those out, Spanish resources. So the fourth Wednesday of every month, and we have, again, taking the information from the surveys to come up with the curriculum and network for next year. So thank you all. Enjoy the rest of your day.